Hey folks, Blair Sacroiliac from Nose Creek Sport Physiotherapy, and today's topic is SI joint lower back pain. So I'm just going to kind of describe an SI joint pain. Typically, we do see this in a lot of different age groups. Most commonly, we're going to see this during and after pregnancy, so it's probably more common in females than males. You don't have any leg pain when you have a true SI joint typically, and what's happened is the pelvis is just rotated forward a little bit, and there's a bit of a sort of a stuck joint in the back of the pelvis. Typically the pain will be very localized to that dimple just on the inside top part of your cheek, and you can almost put your finger on it. So when patients come in, they'll often say it just hurts right here, and they'll localize it. And that's a good description of it. And often it's aggravated by sitting, standing, bending, like everything hurts. It's quite a disabling sort of injury. And so one thing that you can do at home that's going to help you is to try and sort of derotate your pelvis and stretch a little bit. So let's say, for example, my right side has shifted forward in the pelvis. So we've got the sacrum. The SI joint stands for sacrum, which is the upside down triangular bone at the base of your spine, and then the big innominate bones that form your pelvis, or the bowl of your pelvis. So what we're going to do is we're going to lay down on a bed, okay, and we're going to pull our affected leg, so the side that we're sore on, in this case it's the right one, towards our chest. And that's going to end posteriorly or backwards rotate that innominate that's kind of shifted forwards. The opposite leg, we're just going to hang over the edge of the bed. And we're just going to slowly pull it in towards the chest, further and further within your pain-free range. And you can even have your spouse or your friend gently push down on the knee on the opposite side to create a little bit more of a stretch. And you can sort of do like a hold relax where you pull up into their hand for 10 seconds, they relax and over press for 10 seconds. And maybe do that, 3 or 4 times, and you could do it, certainly 3 times a day for sure. These typically don't get better on their own, but this is something that you can try at home that may give you a little bit of relief. Typically we have to do some manual therapy on to get your pelvis back to a neutral position, and then offer you some core exercises to increase the strength of your lower back, your hips, and your pelvic area. And then once we get that strong and fit, typically there's a lesser chance or reduced chance of you having this happen to you again. So I hope that helps. My name is Blair Sacroiliac from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. And again, folks, if this describes any of your friends, family members, or coworkers, please share this video with them so we can help them out as well. All right, so take care. Talk soon. Bye-bye.